So today we are going to discuss few common problems which are causing pain in the shoulder joint, and the various investigations that should be done in those conditions, and then the various kinds of treatments available, and various kinds of myths that are prevalent in the general public about shoulder problems. The commonest word what we hear in the general public with regard to shoulder problems is something called frozen shoulder. Frozen shoulder is a condition which commonly affects the middle-aged and elderly age group patients. That means usually between 40 to 60 or 70 age group patients, and it is very commonly seen in diabetic patients. Even though it has no direct correlation with the diabetic status of the patient, it is very commonly seen in diabetics. At the same time, it can be seen in non-diabetics also. In this condition, the covering of the shoulder joint, we call it as capsule, will get tightened and gets contracted, and this gives a lot of pain to the patient and a lot of stiffness to the patient. If you see, this is the shoulder model here, and this is the shoulder blade, or also called scapula in technical terms, and this is called humerus or humerus bone. This is called the humeral head, and the scapula bone or the shoulder blade has a small cup. It's called glenoid, and the humerus bone has a humeral head. This is the ball-like sort of thing is called the humeral head, and this glenoid and humeral head will form the shoulder joint. This is the normal structure of the shoulder joint. Now, the movements of this ball on this small cup will give movements in the shoulder. This is how a normal shoulder moves. But around this shoulder joint, there is some structure called capsule, like this, in the front and in the back of the joint. This capsule is a protective layer in the shoulder joint, and along with some other structures in the shoulder joint, this capsule gives stability to the joint, so the shoulder joint will not dislocate or it will not come out. So, in patients with frozen shoulder, what happens is this capsule of the shoulder joint becomes thickened and becomes contracted and tightened. So this contraction or the tightening of the capsule gives restriction of the movements of the shoulder. That means the shoulder, which was free to move earlier, now finds it difficult to move. That means the patient complains of difficulty in moving the shoulder, and at the same time, many of the patients complain of a lot of pain, and sometimes there can be severe pain during night, and many patients come to us with lack of sleep in the night due to the pain. And most of the patients complain of pain even when they are at rest. It is not necessarily that they are working or doing some heavy activity, but just while at rest or while sleeping, they can have a lot of pain, and any attempt to move the shoulder can give them a lot of pain. And this is a very common condition, as I told you earlier, and it's very common in diabetics also. Now, coming to a few of the myths that this problem doesn't happen in non-diabetics. This is a myth which is prevalent in the general public. It is wrong. This condition can be seen in people without diabetes also. At the same time, but it will be less common compared to diabetic patients, and also the severity of the symptoms, like the pain, the amount of pain or the stiffness is more among diabetic patients compared to non-diabetic patients. The treatment for this condition, even though it is very severe, as far as symptoms are concerned, and it causes a lot of disability to the patient, it is relatively a harmless problem, and most of the times this problem can recover automatically over a period of time. That's what they say, spontaneous recovery is possible in this condition. And the way we diagnose this condition is, first thing is to listen to the patient, his symptoms, and then doing some clinical examination of the patient, and then we usually ask for initially with some x-rays and all that, and when the patient's condition is severe, we sometimes ask for an MRI scan. And these are the various kind of ways we can diagnose this condition. And once we diagnose this condition, most of the times this condition can be treated with some simple physiotherapy exercises which should be done regularly, and because this is the long-term problem, most of the times we advise patients to do exercise at home. It is not necessary for the patient to go to a physiotherapy center or to go to a hospital every day and do the exercises, because this condition can take many months or sometimes years to recover, and usually it takes anywhere between 6 months to 2 years. That's the amount of time that is required for the complete recovery from this condition. So this is a long-term problem. So we advise the patients to go for some kind of exercise at home, so that they can do the exercise regularly, maybe some 20 to 30 minutes in the morning or in the afternoon or at the night, maybe 3-4 times a day, and they will get gradual recovery. But most of the times the patients have severe pain and they will not be able to do exercises. So in this kind of scenario, what we advise is that to take an injection in the shoulder joint, and usually this is a local steroid or intraarticular steroid injection. And coming to the question of steroids, most of the times the moment we say steroid, most of the patients get scared. They think that steroid is dangerous, or steroid injection should not be taken, and that can cause a lot of damage to the joint, and all these kinds of myths are there in the general public. Steroid injections, in fact, are of various types. The steroids that can be given intravenously or intramuscularly, or steroids that will be given for other conditions like asthma or skin diseases or some other kind of autoimmune disorders, can have long-term consequences. The steroids that will be given in the joint, what we call intraarticular steroids, are depot preparation. That means they act only at the site of the injection. Their effects on the generalized effects on the body are very minimal. So this is a quite safe injection, and this can be taken without any problem, provided this will be given in a proper setting and with following proper sterile precautions. That means a rare possibility of infections can happen with any injection in the joint. So that means you have to take proper sterile precautions whenever you are giving any kind of injection, not only steroid. So if you take proper precaution, the chance of any kind of complications are very unusual. And intraarticular steroids work very well in this specific condition called frozen shoulder, and the patients will get a lot of pain relief. And once the injection is given, in fact, at least in my practice, I see 90 to 90% of the patients will get very good pain relief, and afterwards they start doing exercise at home and they gradually recover over a period of time. Now, sometimes the patients won't recover with physiotherapy exercises or